transfer of contamination with cytotoxic drugs is most likely by 1. Skin contact, 2. Ingestion, so you eat it more or less, inhalation of aerosol and particles, 4. All of them in unequal share, 5. All of them in equal share. Go ahead. It seems an easy one because everybody is responding so quickly. So, okay, let's see. 81% said all of them in unequal share. And actually that's the right answer. Because the exposure is on many ways in potential, and it all depends on how the way you are dealing with the drugs and protect yourself. But really relevant is, I will come later on it, that skin contact is very important. But it's, yeah, good. You are well, well trained, well informed. Great, great. Okay, occupational exposure to the cytotoxic drugs. It's linked to the question before. There are, in fact, in general, 3 options to be exposed to whatever drug, whatever compound. But for the cytodrugs, I will specify a little bit more. Inhalation is an option for particles and vapors. We know that some of the cytodrugs can evaporize. So, for instance, if you have cyclophosphamide, I take it as an example, if you have cyclophosphamide leakage on a table or surface or whatever, we know that it starts to evaporate. So probably when it's on the surface and you come back a week later, then it's not there anymore. It just evaporates. So if you are working in such an area, then you of course can inhale the drugs if you don't protect yourself. That's an issue. The second is ingestion, and actually ingestion is that you eat the drugs. Well, how can you eat the drugs? There are a few options actually. I think there are mainly 2. If you eat and drink in an area where these drugs are, which is actually forbidden, you don't do it, that's an option. But sometimes what happens, and people will recognize, is that you can touch things and then put sometimes your finger on your lips or whatever. And then we call it finger shunt effect. Then you can, of course, ingest it. But that's not so very common. Most relevant is the last one, absorption through the skin. And it has been already known for, I think now 15 years, that this is the major exposure route. And it's quite very simple. When you get in contact with the drugs, and especially when you take drugs or surfaces or touch surfaces, or you take vials or whatever in your hands and you don't protect yourself, it's very easy that the drug is on your skin. You don't see it, but it can pass your skin very quickly. Good example of it is cyclophosphamide. I call it again. And I will come later on every time on cyclophosphamide as the worst case when you talk about cytodrugs. When cyclophosphamide is on your skin, in about 15-20 minutes, 80% of the drug is already in your body, and you cannot take it away. You cannot wipe it away by washing your hands or whatever. So when you touch this drug, or vials or whatever, it's very dangerous if you don't wear gloves. So it's really important. It's a very strong recommendation. Whenever you get in touch with drugs, or think you get in touch with drugs, even when you open packagings or whatever, where drugs and vials are in, always use gloves. You don't need the thicker ones, the very expensive one, but just a thin one can be okay too, just to protect your hands. So whatever you touch and get in your hands, protect yourself. So be aware of that, because the drugs can be very quickly in your body. So the final uptake of this whole process depends actually on a combination of these routes. Do you have a good ventilating area? Then probably skin contact is the most relevant. Have you a bad ventilating area? Then inhalation can be an issue too. But mostly it's a combination of these three routes that gives the exposure if you are exposed. So, and then of course you have your personal protection. So if you use gloves, then you make actually a barrier between you and the drug. So if you get in contact with it and you have it on the gloves, you can throw it away and you are safe with your hands. Okay, so that's the main occupational exposure sheet, how people get exposed to the cyto drugs, but skin contact is really, really the most relevant one. Well, now we look in detail where is the contamination coming from. We know when we do testings everywhere around the globe that contamination is in pharmacy, contamination is in and around cabinets and isolators, and contamination is on the wards, outpatient and outpatient situations. So drugs are there, but where is it actually the most predominant? Where do you find it mostly? I put I focus on two situations. The pharmacy. Well, the pharmacy, there are four main issues which are relevant. It's the vials. It's the spillage during the preparation technique. So if you prepare, there can be spillage or leakage. So it depends how you handle. And also it depends who is handling, because there are big differences between persons who handle the preparation. The biological safety cabinets, or the isolator, and waste. That's the other point. If we go more in detail, for instance, the vial contamination, it's known by many tests done over the years that vials with cyto drugs on the outside can be contaminated. The very simple reason is when the industry is producing the vials and filling these vials, at the end of the process, when the vial is ready, they wash it. But they are not allowed to wash on the top of a vial where you have to flip off. There you cannot wash the vial because there is a potential risk that drugs or water by cleaning is coming into the vial. So it's not allowed. So they wash only the glass part and the bottom part of the vial. So be aware when you have these vials and you touch it and you take it in your hands that they can be contaminated. So when you touch vials, use gloves. It's known that many of these vials are contaminated. And also the packaging, the carton packaging. Inside, when it's on the vial, it will also be on the packaging. So when you open packaging, always have gloves on. The handling technique is also very relevant because you can realize when you have a vial and a needle syringe and you put a needle in the vial, you take it out, you have the over and under pressure problems there. So you have leakage there. So if you do it in that way, there's always the potential risk of being exposed and get contamination. The cabinet, the biological safety cabinet, and the isolator are in fact designed for protection of the drug and the preparation. They are not designed for your safety. A lot of people think when I work in a cabinet or in an isolator that I'm working in a safe environment. If you take a cabinet with an airflow and you put your hands in, you always disturb the airflow, so it's always airflow going out. So you can be exposed to that. It's the same with an isolator. If you open the isolator at the end to take products out, you can be exposed to there. So isolator and cabinets are not designed to protect you. They do a little, but they are not designed for it. And then we have the waste. In the end, we have a lot of cyto waste. We have the vials, we have the syringes and all these things. And what's seen many days now, still seen nowadays, is that when it's thrown in a waste bin, where you have these, how do you call it? You put it with a pedal and then you get this effect. So if you open it that way, then you get a turbulence therein and all these drugs are coming out. So if you use this kind of systems, which are in fact totally open systems, then you get a lot of drugs getting out and you get, of course, exposed. So you get it on your skin, you get it on your face. So it's really not done to use these things anymore. And there are devices who can save it and seal it actually, so you need not to be exposed. So very simple solutions for this. That's the pharmacy. Now we go to the ward in an outpatient nursing, and well, there it's a little bit more complicated. And the reason is very simple, because in the pharmacy we work with bottles, and in the nursing we work with patients. So that's totally different. And a vial you can handle and you can manipulate in the way you want, but the patient is more problematic. A patient is, it wants to move and has a lot of drugs in his body or her body, and so it's not so easy. And I've seen in many hospitals that patients' departments are spread, where oncology drugs are used, are spread around in a hospital. So you have many departments where these drugs are used. And it's more policy nowadays to concentrate this all together on one department, or probably two, to have control over potential contamination and exposure. So it starts in the ward, inpatient, outpatient nursing, where all these prepared drugs are coming from the pharmacy. And I think here in the UK, too, then in general, pharmacy is preparing all the cytodrugs. And then it depends, of course, how they do it. And of course, there will be a lot of pharmacy departments who do it perfectly and whatever. But in general, we know that a lot of bags with drugs coming to the wards are contaminated on the outside. Very simple. In an isolator where you do a preparation, you will always get drugs there. It's getting on the bag. Of course, they try to clean, send it to the ward, but it's always the case, or mostly always the case, that these bags get contaminated. So if you touch them, have gloves on. Then you have, of course, the patient. The patient is a very, you work for the patients, of course, but the patients, I call it always a bomb. The patient is a bomb with drugs. And wherever the patient is going, there will be drugs. So if the patient takes a shower, there will be drugs in that room. If a patient is going to the toilet, there will be a lot of drugs there. If a patient is moving to relaxed area, whatever, to meet family members, there will be potential contamination. So wherever the patient is moving. And then you have, of course, the linen, the clothing of the patient with a lot of sweat inside, probably urine. It's all be there. So if you take the linen from bed and you put it this way, then you get all the aerosols with the drugs going around. So you have to be really careful when you do it to avoid a lot of circulation of these potential drugs in these bed linen. Then we have to deal with the waste. Actually, there's the same problem as in the pharmacy. You have a lot of these waste bins like this, and you see all these drugs coming around. You don't see it, but it's there, I can assure you. So take care of that too. And of course, as I said already, the patient's clothing and laundry. That's another issue to think about. So there are a lot of things to manage. And of course, you cannot do it all perfect, I know, but it's good to know where the pitfalls are, where the problems can be.